The Clarius being wireless is a massive help for us. And the ProbeFix allows for better consistency just through allowing us to keep the same image on the same area of the muscle during walking. So the combination of the two is extremely effective for what we're doing. I'm Corey Grozier. I got my start with ankle biomechanics when I was an undergrad, and about a year and a half ago, I got a position here at Michigan State, really looking at some of the ultrasound and structures and some of the different changes that we might see to the body after ACL reconstruction. With the ProbeFix, our research is really kind of focused on walking biomechanics. So really what we're doing is, with some of our patients that we have coming in, we're focusing on trying to get a better idea of what the structures of the quadriceps muscles look like during walking. The ProbeFix has been kind of crucial in that because standard ultrasound kind of limits what you're able to do, and the ProbeFix, along with like the Clarius, has been able to allow us to have patients walk around more freely and kind of give us a better idea of what all is going on with each individual that's coming in. It's a really big advantage for our patients to be able to move around and get a better idea of what they look like when they're walking and how their muscles are really kind of activating during that walking period. Realistically, the problem that we would run into with a normal ultrasound machine would really just be the fact the wires are getting in the way, and it becomes kind of an issue of making sure the patients are comfortable. So the Clarius being completely hands-free and wireless in that instance really just helps us to gather better information for each of our patients. The ProbeFix allowing us to get a better idea of what this singular area of the muscle looks like, and the Clarius allows us to get this really accurate picture of the muscle and the kind of the structures within during walking. So the two of them in combination really just allow us for the most effective use of our time, as well as the best ability for us to kind of understand what each patient has for quadricep kind of fascia length and pennation and things of that nature. So extremely effective in that instance. The application of the two together is extremely easy. We took us about an hour to kind of fully understand from the minute of taking it out of the box to using it with a patient. It was extremely easy in that sense. And not only was it just easy to kind of understand how to use, but it's also easy for the patient to kind of understand what they're doing as well. And they don't need the information each step along the way. It's just kind of you use it once, and then after that, everything's fine. They know what they're doing without having to adjust time after time. Recently, we've been kind of confined to our lab space to kind of get a better understanding of what patients might be experiencing after ACL reconstruction. But these two in combination allow us to explore a lot of different possibilities, whether it's outside the lab or with more dynamic sports. So typically we'd be kind of confined to just walking, and now we can do things like running. We might be able to do some more jump landings and more activation of muscles in that sense, as well as looking at it in more of like a dynamic sense with sports as well. I think we're really excited about what we can do in the future with the both of them.